Hello and welcome. I am Shayne and I want to thank everyone for tuning in. I am here to help others navigate their journey of dealing with a loved one with Alzheimer's. As many of you may know, my mother was diagnosed with early onset Alzheimer's at the age of 69. And for the last 6 years, we have been on quite a journey as she is living with Alzheimer's. I have learned so much in the last few years that I would love to be able to pay it forward. So if I can be a resource to anyone and their family, I'd love to do so. So today we are sitting down with Victoria from the Alzheimers Association. She is the program manager for Palm Beach County. So welcome, Victoria. Thank you for being with us today.
Hi, thank you so much for having me, Shayne.
Why don't you introduce yourself a little bit? Tell us a little about you.
All right, well, thank you. All right, well, as Shayne mentioned, my name is Victoria Didio. I am the program manager of Palm Beach County for the Alzheimer's Association, as well as helpline specialist. I have been with the Alzheimer's Association for just under a year, and it's just such a great, fulfilling job, and being able to provide care and support for the individuals that are going through the disease and either living with it, or as well as being a caregiver, or just someone who's involved in any way. And I'm just so happy to be available to those individuals and provide care, support, and education.
Well, I know we are all appreciative for what you and the organization do. Can you tell us a little bit about the services that the Alzheimer's Association provides for those with Alzheimer's, their caregivers, and their family?
Of course. So here at the Alzheimer's Association, our vision, of course, is a world without Alzheimer's disease and all other dementias. So we are accomplishing this by a few different aspects. First, what we do is provide care and support. So we provide care and support by, we have a 24-hour, 7-day-a-week helpline that is available to everyone and anyone who may have questions about the disease, or how they can get involved, or what resources are out there for them. If they call the 24-hour 7 helpline, then they will be put in contact with their local representative. So that way we can make sure that they're receiving their local resources. But of course, we have chapters across the nation, so providing these services to our community. We do support groups, as well as connect them to any local organizations that they may be needing. As well, we educate and raise awareness. So we do educational programs. Currently in the state of Florida, we have our virtual brain bus program, which usually we will travel around the country, around the state, providing these services. But currently, due to COVID, we are working virtually and providing these educational programs. So that way, different programs that they're able to attend, such as Know the 10 Warning Signs, or Healthy Living for the Brain and Body. Different ways of educating themselves on the prevalence of Alzheimer's disease and how to notice it when it comes about. We also do have a virtual caregiver college series, which is more for those individuals who are in the midst of the disease, and maybe how to work with those individuals who have the disease and work through the progression, such as understanding the related behaviors associated with Alzheimer's disease. And so how to really continue that communication and knowing how to best prepare themselves for this disease progression.
As a caregiver, that was a huge, huge help, and a wonderful, wonderful resource.
I'm so happy to hear that. And then, of course, we are the top association when it comes to accelerating research across the globe. So we're the largest not-for-profit funder of the Alzheimer's research, committed to accelerating global progress towards methods of treatment, preventions, and ultimately a cure. And of course, we also advocate for the association's the leading voice for Alzheimer's disease advocacy, ensuring that the need for Alzheimer's care, education, and research is heard at every level of the government.
All important things. You guys do so much out there. You are such a tremendous, tremendous resource. Tell me a little bit about the type of people that call in for help, the type of people that really need your assistance.
Okay. we can have a very large range of individuals who call for our assistance. It can be from individuals who were just diagnosed with the disease. And they might have been told by their physician to contact us for more information. And that's what we hope to do, is also get those physicians working with us as well, so that way they are providing this resource to individuals that they see. It can be a child, a spouse, whomever is involved with this diagnosis process and needing that further assistance on what do I do? What do we do next? How do we plan? It could be an individual who is just struggling with the behaviors, or I can't seem to get them to take a shower, and so just that education on how to redirect and accept what they're saying. And many times it's difficult for individuals to talk to others that they're used to talking about this because they might not understand. So we're always there as an open ear and saying, we understand. Come talk to us. Let us help you through these steps. It can be children of individuals. It can be grandchildren. Really, we are available across all age levels. And so we just hope to get that awareness out there. So in anyone of any age, any denomination, any aspect knows that we're available to them.
So if you are out there and you are dealing with yourself or a parent or a grandparent or a loved one or a family member, and you're not quite sure if it is Alzheimer's or dementia, or if it is just normal aging, or if you need a resource, if you need help, if you need a caregiver, or if you are a caregiver and you need some respite, you can always reach out to the Alzheimer's Association, and they have so many resources and places to guide you. One question. So I just did it myself, and a lot of times people will use the term Alzheimer's and they'll use the term dementia. Sometimes they're used interchangeably. Can you kind of define those two terms for us and tell us how they're related?
Yes, I'd be more than happy to, because as you mentioned, the word dementia and the word Alzheimer's disease is very often used interchangeably. Very often we just hear, my loved one was diagnosed with dementia. And our first question to those individuals are, what type of dementia? Because as we like to look at it, how we explain it is dementia would be an umbrella term. And then there's the different forms of diseases that cause dementia. Dementia is the symptom that people exhibit. So Alzheimer's disease is the leading cause to dementia. There's also other aspects such as Lewy body's disease or vascular dementia. So different aspects can cause dementia. And so what we do know is Alzheimer's disease is the leading cause. But again, it's very important for that early diagnosis to really see what individuals are dealing with. Another way I like to explain it, because it does help individuals put it more into perspective, just as if you have an individual who comes to you and says they have cancer. First question out of your mouth is usually, what kind? What type of cancer? Because as we all know, there's a large amount of different forms of cancer that an individual can have. So very often when someone tells us that they have dementia, our first question is, what type of dementia?
And do you recommend that people get diagnosed? There are doctors that can diagnose what type of disease it is that is causing the dementia?
Yes, we definitely recommend diagnosis and as early as possible. Oftentimes people will kind of push off those 10 warning signs as a normal part of aging. And so what we do like to do with the 10 warning signs is really give that breakdown of what's normal aging and forgetfulness and what's cause for concern. As we know that Alzheimer's disease or dementia is not a normal part of aging. Yes, age is the biggest risk factor, because as you age, you have more risk of developing. But we want to make sure that individuals are recognizing these little risk factors of possibly could be something, mild cognitive decline instead of a natural, normal aging process. And so, right, the earlier you're going for those appointments with your doctors, even starting in your 60s, of doing those mini mental examinations with your physician, so that way you have a baseline. And each year you're able to have this testing done. So that way, as you age, you know what your baseline is, and if you see any decrease in your cognition.
Right.
And the earlier that you're able to get a diagnosis, again, it gives you that opportunity to educate yourself about the disease and family members to learn about the disease, as well as what's really important is that planning aspect. You want individuals to be the individual with the disease to be part of that planning of what do they want, what are these steps. Maybe they want to see if they can get involved in a clinical trial. So there's a lot to do with that early diagnosis of it.
I will say that was something that helped in our case. My mother had cared for her mother who had dementia and Alzheimer's, and she saw it coming on herself, and it was scary because she kind of knew what was coming down the line. So we were lucky in that we did get diagnosed early. But I would definitely recommend, and it might not be dementia. It might be, like Victoria said, just normal cognitive decline that comes with aging. But it's so great to know which one it is and if it's one or the other.
And as well, the importance of seeing your physician and doing these annual exams, because not only can it be a normal part of aging, but other medical conditions can cause some forgetfulness, or like drug interactions of prescription medications. Depression is a huge, will show same symptoms. So you want to make sure that you are checking other physical ailments that could be causing this decline in cognitive ability as well. We don't always want to say it's Alzheimer's or dementia, because there are other factors that it could be.
Right. And like you said, there are other types and diseases that cause the dementia, like the Lewy body and the frontal temporal. So those can also bring with it other things as well that may need to be treated or looked at. So it's important to have that diagnosis.
It is.
So in this crazy world we're in right now with this health crisis going on, how has what you do kind of changed? I know you said that the brain bus, which we used to see around town, is now more of a virtual brain bus. What about your support groups? Are those still happening, just now on virtually?
Yes, we are still providing support groups, and they are all either virtual or telephonic platform. And currently, as a state of Florida, we have all come together and with our programs, such as support groups. And so now that there are numerous support groups at everyone's fingertips, because we know that in the caregiver's life, they might not be sure when they're exactly able to join a support group. So what we've come to is that now individuals are able to join a support group at their convenience, no matter if it's taking place out of our Gulf Coast chapter or the North Central Florida chapter. No matter where you are in the state now, if now is a good time for you to join a support group, it's available.
I'll say that was another thing that has been a huge help to me. I've been part of a Alzheimer caregiver support group now for 2 years, and it's so nice to be able to talk with others who are going through the exact same thing. And it might not be the exact same, it might be slightly different, but to hear what's worked for other people or help from other people, and just have that community to know you're not alone. So whether you're just starting this journey with a loved one, or if you're 6 years into it, I definitely recommend checking out one of the support groups and finding the one that fits best for you.
Exactly.
Tell us a little bit about Project Vital.
Okay, Project Vital. Project Vital, we have partnered with the Department of Elder Affairs of Florida, and have been providing across the state tablets to these assisted livings and nursing homes, so that way individuals are able to stay connected. As we know, during this time that family members, loved ones aren't able to visit and see their loved ones in person, and can be difficult across the board for family members as well as those individuals who are living in these facilities. And to decrease the fact of isolation, we have been providing these tablets to individuals, to these facilities, so that way their residents are able to stay connected with their family members. And just an individual like you or me, if our mother or father is in this facility, we're able to FaceTime with them. And so that way that they are still able to see and connect with individuals and stay connected, because we know that with this disease, isolation can be a huge factor for a decline. And so we are doing our best to make it available across the state where these individuals still are able to connect and spend time with their loved ones.
That is so important. The connection, the socialization, especially when you're dealing with someone with dementia, because it's something that stimulates their brain, which is so important. So I love Project Vital. I think I'm so thankful that you guys are partnering with them to get that done. So tell me, how can people find you? The best way for people to find you?
All right. Well, we have two ways that I would say would be the most beneficial to individuals to find us. Our number one resource, I would say, is our 24-hour, 7 days a week helpline number, which people can call at 800-272-3900. And like I mentioned, this phone number is our helpline, and they are open 24 hours, 7 days a week, as well as they serve in like over 200 different languages. So no matter what language you're comfortable with speaking, they're available to help you. And they can provide a care consultation. So if there's something that an individual needs right away on how to do something, they're available. As well, they will then put you in contact with your local representatives. So that way you would have that local representative, such as myself in Palm Beach County, reaching out to you and to follow up, make sure you're getting the resources that you need. As well as our website, alz.org, full of great information. And again, it would put you in contact with our helpline. That would also put you in contact with your local representative.
Wonderful. You guys have so many resources available to the community, whether it's education, whether it's individual help with helping someone get diagnosed, helping someone get the care they need. I cannot explain the wealth of information that I have learned from the Alzheimer's Association. So if you're out there and you do need assistance, again, we will post the number for the 24/7 helpline. You can always contact me directly, and I can put you in touch with Victoria or some of the services you may need. Thank you, Victoria, so much for being with us today. Please stay safe and enjoy the rest of your day.
All right. Thank you so much for having me.
Thank you all for being here. We hope to see you soon.